Welcome to the WebMD Health Discovered podcast. I'm Dr. Neha Bhatak, WebMD's Chief Physician Editor for Health and Lifestyle Medicine. It's summer, and unfortunately, that means that it's part of our ever-lengthening fire season. In 2023, there were over 56,000 wildfires across the U.S., which burned a total of over 2.6 million acres. Even when we're not in the path of a wildfire, we can still be impacted by it and its after effects, including smoke. Many of us remember the impact of the wildfires in Canada last year and how the smoke ravaged the northeastern region. And even down in Georgia, where I live, we had some air quality alerts because of those wildfires. News coverage about wildfires usually stops after the emergency is over. But what about the acute and the long-term health issues we might experience? Climate change has emerged as one of the most pressing global issues of our time, influencing weather patterns, increasing the frequency and intensity of heat waves, and exacerbating wildfire incidents across the globe. These environmental changes have profound implications for human health, from lung and heart disease to skin issues. Understanding the intersection of heat, climate change, wildfires, and health is crucial for us to develop effective strategies to protect our families and ourselves. The relationship between climate change, wildfires, and skin health is an emerging area of concern. We know that airborne pollutants from wildfire smoke can have detrimental impacts on our lungs, but we're learning more and more about the dangerous impacts on our skin. Particulate matter, which are tiny particles suspended in the air, and toxic gases can cause oxidative stress, leading to inflammation, premature aging, and worsening of existing skin conditions like eczema and psoriasis. Long periods of exposure to polluted air can weaken our skin barrier, making it susceptible to infections and other types of irritation. On top of that, certain chemicals used in firefighting, such as ammonium phosphate, are known skin irritants, and in the setting of a wildfire can also become part of the particulate matter and travel long distances, potentially impacting our health. We sat down with two experts to discuss the overlap of heat, climate change, and health, with a special focus on what the science and data tell us about the damage this combination can have on the largest organ in our body, our skin. First, let me introduce my guest, Dr. Shadi Karush. Dr. Karush is a board-certified dermatologist and associate professor of dermatology at Harvard Medical School. She's a graduate of the Harvard School of Public Health and the University of Texas Southwestern Medical Center, where she received the institution's awards for leadership and outstanding professionalism and humanism as a physician. Welcome to the WebMD Health Discovered podcast, Dr. Karush.
Thank you so much. Good to be here.
So I am really excited to dig into our conversation. But before we do, I'd love to start with your own personal health discovery. What was your aha moment as you studied the climate, wildfire, and the impact on skin?
I've always been particularly concerned with problems in the community that may disproportionately impact vulnerable populations. And so how I came to be interested in the role of climate issues and specifically air quality, which is what I've done research on, is when I began to see the direct impacts on my patients. So for example, last year, after the wildfire events in Canada, when the Northeast region of the United States experienced our worst air quality in history, New York, Boston, the major cities in this region, I began to see the impact on my patients. A series of patients started to come into dermatology clinics at the end of spring, beginning of summer, saying that they were having flares of eczema. And this was unseasonable because, as we know, as doctors who care for patients that have eczema, usually the flares are in the wintertime due to multiple issues. Yet these patients were coming in saying that for the first time that they could remember, their eczema was terrible during a time of year that they didn't expect. And I had a patient in particular who had never really struggled with eczema or skin issues, who had been in New York on the day where it was recorded that it was the worst air pollution in history, where he said that he could visibly see the air pollution around him. And after this, he began to develop issues on his skin that we had to help work up and investigate for him. And so, after listening to a series of patients report this, you begin to step back as a doctor and recognize the pattern and recognize that something's going on. And so, I and my research team, the wonderful medical students and residents that work with me on research projects here at Mass General, began to talk about how we could study this. And so we first went to the publicly available EPA data. The Environmental Protection Agency publishes publicly available data on air pollution levels, especially in major cities. And we started to look at the year that we were in, 2023, compared to the past 4 years prior to that, to look at historical controls, and going back even before the pandemic to make sure that there were no confounding impacts of the pandemic. And then at the same time, we worked with our own hospital system, the Mass General Brigham Hospital System, which is the largest hospital system for the state of Massachusetts. And we worked with their information technology staff to query in an anonymous fashion our own database to look at statistics of patient visits. And we could search that in a de-identified way, just looking for numbers of visits due to eczema flares, asthma flares. And we also compared that to the prior 4 years. And we saw a noticeable spike in both pollution levels and visits for eczema flares and also asthma flares, during that time period. So it was this synchronized and unseasonable spike in both pollution and in visits for eczema. And so that's when we started to step back and realize that the series of patients that we were listening to in our own clinic was not an isolated scenario, that it was a reflection of a larger issue that was happening throughout our region in people experiencing the skin impacts, the negative health outcomes on their skin as a result of poor air quality and acute air pollution events.
What are some of the pollutants of concern, particularly when we're thinking about wildfires? And do you have any way of helping us understand how specifically do they impact our skin? Are they breaking down the barrier? Are they causing more aging? How are these pollutants impacting our skin?
That's a great question. And there is some information that I can share with you, but I say this with the caveat that I think we're learning more about this and that there's a larger story to be told. The two main particulates, or the two main air pollutants that we looked at in our study and that have been studied with the greatest attention in recent years, are PM 2.5. So that stands for particulate matter that is of a certain size. And actually, there's more than one chemical that fits into that category. So I want to emphasize that there are actually multiple irritant chemicals that go into PM 2.5, but that's sort of the marker that is mostly studied. So that was the highest levels in history around this time of last year, June of 2023. And then also we looked at carbon monoxide. And the reason for that is because in other regions of the world that have really struggled with air pollution, such as China and certain other countries, carbon monoxide levels had already been correlated with eczema flares in children. And so our group looked at that, and that's what really inspired us to look at carbon monoxide. The other reason was because we started to study atmospheric data and literature in the environmental science field around air pollution in our own efforts to better understand what was happening to our patients. And from that literature, we learned that carbon monoxide is actually a more useful measure of long-range impacts of air pollution because it actually travels over longer distances and can be measured. And so that's the reason that we also wanted to look at carbon monoxide, for example, in Boston or New York, because that could be an indicator of this downstream effect of the wildfire wildfire smoke that was in Canada and in the Northeast region. And so those are the two main measures that are being studied and that we looked at in our study. That being said, there are other factors that could be important. For example, sulfur and sulfates and sulfur dioxide, which, historically has been important and has caused negative outcomes in human health. And this has been studied going back to the 1950s in London, when the infamous London smog, which was another example of an acute air pollution event, caused many negative health outcomes and even deaths in London at that time. So that's one particulate that, for example, could go into measures of PM 2.5, but there are others as well. And then there is the other effect of the measures to put out the wildfires. For example, we looked at the chemicals that are used to put out wildfires by fire departments. And one of those chemicals is ammonium phosphate, which is a known irritant to the skin and, potentially could irritate the airways and have other effects. So this could be an important concern for the occupational impacts on members of the fire department that may be called in to put out these wildfires, or individuals that may be living in close range to the wildfires. They may be experiencing skin problems not only from the smoke and smog of the wildfires, but from the chemical irritants that may enter the air as a result of efforts to put out the wildfires.
So I think that's really crucial to understand, that it's not necessarily just the wildfire smoke, but the chemical irritants from what we're using to put out those wildfires locally, and then perhaps spreading in the air as these tiny particles. And we're still learning more about how far those particles can travel. So my next question then is just thinking about, you mentioned eczema as one skin manifestation. Are there other types of skin manifestations that we're seeing that worsen? So premature aging, skin discoloration, acne. Just curious about other types of manifestations of skin problems.
Great question. And the answer is all of the above issues that you mentioned. So absolutely, that the acute impacts that we see are the inflammation caused by these chemical irritants and air pollution. So, there are the short-term effects and the longer-term effects. So in the short term, in the immediate effects, we see the exacerbation of inflammatory skin conditions like eczema, or people that have really sensitive skin may develop contact dermatitis, allergic or irritant dermatitis from these issues. And the result of that could be hyperpigmentation, because certain skin types, when they become inflamed, the result is that they develop hyperpigmentation. And I can tell you, as I'm also the director of the Pigmentary and Multi-Ethnic Skin Clinic at Mass General, and a lot of the issues of melasma and post-inflammatory hyperpigmentation that we see are the secondary effects of eczema or allergic or irritant reactions. And so as pollution is a known cause of these, we certainly saw a lot of hyperpigmentation in the wake of acute air pollution exposure. So absolutely, melasma and hyperpigmentation is one of those. Acne can be worsened by certain chemical irritants. So depending on which exposures a person had, there could be a role of this. And then also the smog and smoke simply clogs people's pores. And so in people that are prone to acne, if they're living in these urban polluted environments with poor air quality, certainly their acne could worsen from this. And then, as you mentioned, there are the longer term effects, because we know that these chemical pollutants settle on the skin barrier. They settle on our skin, and they actually corrode the lipid barrier of the skin and cause DNA damage. And certainly this has led to premature aging that has actually been studied in other parts of the world in very good studies that show corrosion of the skin barrier and DNA damage from pollution. This has been studied in Europe and in China, for example. So we in the US had the luxury until more recent years to not have to deal with some of the issues that, our colleagues in other parts of the world that were heavily polluted regions were already seeing from the healthcare standpoint. Well, it appears to be upon us now. We are now dealing with the acute and long-term outcomes of pollution. So certainly it corrodes the skin barrier, it causes DNA damage, it causes premature aging of the skin. And so these are all considerations that we as physicians now have to counsel our patients about in terms of trying to protect themselves.
To learn more about the impact of climate change on extreme heat and wildfires, we spoke with Dr. Daniel Swain. Dr. Swain is a climate scientist in the Institute of Environment and Sustainability at the University of California, Los Angeles, and holds concurrent appointments as a research fellow in the Capacity Center for Climate and Weather Extremes at the National Center for Atmospheric Research.
Extreme heat is actually one of the deadliest types of weather events that we experience in the United States and in many places globally. And one thing we're seeing in a warming climate is not just increasing daytime temperatures, which is fairly obvious. You see the hottest part of the day is getting even hotter than it used to be. But we're actually seeing faster warming at night in many places. In fact, in some places, the nighttime warming or lack of cooling really at night is almost twice as fast as the rate of heating during the daytime hours. And this is particularly consequential for human health because at that nighttime coolness is when our body tends to recover from the accumulated stresses of heat, of extreme heat during the day. And if we don't get that reprieve, if we don't get that break at night, that makes the increasing occurrence of extreme heat even more dangerous because we're not getting that built-in recovery every day. You can artificially recover if you have access to active cooling, like air conditioning, for example, but not everybody does. And so this results in some pretty major health equity issues where folks who don't have access to air conditioning are increasingly more and more affected by these warmer and warmer nighttime temperatures during heat waves in particular. This also has important implications for wildfire, too, because, of course, warmer and warmer daytime temperatures, you get a little bit of extra push towards highly flammable vegetation conditions. But some interesting research is suggesting that once again, it's at night where some of this warming is having the largest impacts on wildfire, because historically, much as the human body can use the cooler temperatures overnight to recover during heat waves, wildfires historically would tend to calm down at night because the temperatures are cooler. The relative humidity usually comes up a little bit. It's not quite as dry. And once you get toward the middle of the night, those winds would die down. But increasingly, what we're seeing, and this is something that has been broadly true, especially across the American West, but also elsewhere, is that those nighttime temperatures, because they aren't cooling as much and because we're not seeing relative humidity increase as much as we used to in those cooler overnight hours, fires are burning more actively through the night. And this means that not only do they have essentially twice as long to cover ground as they used to, where they would advance in the daytime and really slow down during the night, but it means that the way we used to fight some of these fires has had to shift because firefighters used to use the night as a safer time to directly approach these fires. You can imagine if you're on a fire crew on the ground hiking into a canyon, you'd much rather approach the fire when it's calm and moving slowly at night than when it's moving rapidly upslope during the daytime. But we're losing those potential windows. Fires are remaining active through the night. And so these increasing temperatures, it's kind of the quiet warming at night that really is quite consequential, both from a human health perspective and from a wildfire perspective as well.
Right now, millions of Americans are under some sort of heat advisory. And the information Dr. Swain shared really puts this relationship between heat, wildfires, and health into perspective and helps us understand how our future risks might be even larger than they are today. I asked Dr. Karush about the direct impact of heat on the health of her patients and what she's witnessing in her clinic more commonly than she was before.
So, in the same manner that we discussed with respect to pollution, with chronic heat exposure, there are both the acute, the shorter term, and the longer term effects, whether it's acute versus chronic. So, in the acute sense, there are certain skin conditions that are worsened by heat. One of them that is well known is rosacea. So, a lot of people experience rosacea flares when you have heat waves because their condition is a heat sensitive condition. For example, it's both sun sensitive and heat sensitive. Another condition that could worsen is melasma and hyperpigmentation. As the director of the Pigmentary and Multi-Ethnic Skin Clinic at Mass General, people come to me from around the country, sometimes around the world, with issues of hyperpigmentation. And I have seen patients that had chronic heat exposure as a part of their job, as a part of occupational exposure, that really struggled with that. People that, for example, work in kitchens near an oven where the heat from the oven would blow in their face, and this would prevent their melasma or their hyperpigmentation from improving, despite their best efforts to put on sunscreen or cover their faces with hats and sunscreen when they went outside. So hyperpigmentation and melasma is also a heat sensitive condition. Premature aging of the skin can be caused by heat exposure. In recent years, we have learned more about the different forms of radiation that cause aging of the skin. And we've learned that it's not just ultraviolet radiation, but also visible light, infrared radiation, and then also pollution, as we discussed, that are contributors to premature aging. And so there's evidence that infrared radiation, which is thermal heat radiation, actually can cause DNA damage and premature aging. And that can be displayed in multiple ways: breakdown of collagen and elastin in the skin, hyperpigmentation, as we discussed. And then finally, again, on the theme of occupational exposures of firefighters, these firefighters that are out fighting these wildfires, they're often exposed to, thermal radiation, heat radiation at higher levels over time. And this can put them at increased risk of skin cancer. In dermatology, we talk about precancerous, not just skin cancers, but there are signs on the skin, precancerous signs of the skin called actinic keratoses, which are these spots on the skin that develop as a response to high amounts of sun exposure that then cause skin cancer. Well, there's such a thing as thermal keratoses, where due to chronic high levels of heat radiation, it can increase a person's risk of skin cancer. So again, my sensitivity and concern as a dermatologist really goes out to these firefighters and people that are in close proximity to these wildfires.
For many of us, this discussion of climate change, wildfires, and health is shining a light on the health issues that impact the most vulnerable people in our communities. Many of the things that we need to do to protect ourselves and our families are relatively simple and straightforward. Dr. Swain offers some protection measures that many of us are already familiar with.
Well, I think most folks intuitively have a sense that breathing in smoke is probably not great, especially for your lungs. And that is, of course, true. We do tend to see increases in things like asthma attacks and people who struggle, who have other respiratory conditions. So, of course, breathing in that wildfire smoke is not good for your lungs. But I think there's another side to this that's a little less recognized, where wildfire smoke is a little more insidious, if you will. It's also really bad for the cardiovascular system. Some of the particles that are contained in wildfire smoke are very small. So small, in fact, that when you breathe them in, they can actually enter your bloodstream, which means that it can cause systemic effects because, of course, your circulatory system goes everywhere in your body. And this is why not only do hospitals and emergency departments see spikes in admissions for things like asthma attacks during wildfire smoke episodes, but also major cardiovascular events, so heart attacks and strokes. So this really isn't good for your whole body to be breathing in the smoke. Obviously, if you're in a region that's exposed to a lot of wildfire smoke, it can be difficult to completely avoid, especially if you work outdoors, if you work as an agricultural worker or in construction, or anything that forces you to be outside. One important thing to know is that masks like N95 masks really can help you prevent breathing in a lot of those ultrafine particles that are particularly dangerous. And employers really should be offering those kinds of masks to their employees who need to be outside at these times. If you're indoors, air filters, much as indoor air quality was important for mitigating COVID risk, those very same HEPA air filters do a great job at reducing wildfire smoke if you're indoors too. So you can have a little more control of your indoor environment there as well. But, the more we learn about wildfire smoke from a health perspective, the more concerning it looks and the more important it is to mitigate those risks, either by wearing masks outdoors when it's bad or cleaning your indoor air too.
So I'd love to then take us from really this discussion about some of the health risks and shift us to what we can do to protect our skin health. So can you talk us through a little bit about what you kind of counsel your patients on when you're thinking about skin health in this climate changing world?
Great question. So again, I would answer in sort of the acute sense and the longer term sense. So as physicians who are concerned about our patients dealing with, this situation that in many ways we've never had to deal with before, and which is not going away. I mean, the UN guidance on this issue is that these wildfire events are not going away, and we have to find a way to live within them and work on the issue in sort of a longer term sense, but also protect ourselves in the short term sense. So short term protection, what I recommend for my patients is during the acute air pollution events, like we saw in the Northeast region of the US last year in Boston, New York, in these major cities, we counseled patients to stay indoors if they could, to keep their windows and of their homes and their cars closed. And for patients who are able to obtain air filters, for example, HEPA air filters for their homes, this is also recommended. So to do the best we can, because our buildings, by and large in the US, are also not structured to address this problem, as in the ventilation systems of most buildings simply pump the air from outdoors to indoors without cleansing it of pollution. And so this is a bit concerning, more than a bit concerning, actually. And, I have colleagues here that I work with at the Harvard School of Public Health, wonderful Professor Joe Allen, who is working on a healthy building initiative, where he's sort of advising with our chief sustainability officer in terms of making our buildings more friendly in terms of pollution, protecting people from pollution. But most buildings in the United States are not structured for this. And so our advice to patients is to try to obtain air filters where they can for their homes, these, air filters that you can purchase for yourself, and to keep your doors and windows closed if possible. And then also for people that have to go outside as a part of their activities of life or work, and especially for our patients, as you mentioned, who have to work outside, to protect their skin and airways to the greatest extent possible. And that could be by wearing clothing that protects their skin, and that could be difficult because they need to find light, breathable fabrics that won't be too heavy for their skin, but will cover it from the sun and from pollution, and to wear masks and to wear sunglasses, because protecting the surface of our eyes is important, not just from ultraviolet radiation and the sun, but actually from these airborne particulates in pollution. So wearing masks, wearing sunglasses, wearing clothing to cover our affected areas of skin. And then also certain sunscreens can be helpful. And this would be the mineral sunscreens that contain zinc, titanium, and iron oxide as their active ingredients. And so I always recommend to my patients, I don't recommend any particular brands, but I do recommend certain ingredients. So I instruct my patients to flip over that sunscreen bottle and read the ingredients. And if there are long chemical ingredients, that's not what you want, because the long chemical filters, they only really protect you against ultraviolet radiation. They don't protect you from heat radiation. They don't protect you from pollution. And so the mineral filters do, actually, to some degree. And so I would say invest in a mineral sunscreen. When you flip it over, it has a nice short mineral term as the active ingredient, like zinc or titanium, and really layer that on your skin. And then put on a mask, put on sunglasses, try to wear protective clothing. And so that's what the best that we can do to protect ourselves in the short term sense. In the longer term sense, however, as I alluded to with, for example, the Healthy Building Initiative, and, I work with a team of doctors here at Mass General, some wonderful colleagues in our Mass General Office for Environmental Health. And we're thinking about ways to advocate for our patients to be protected in a more structural way, and I think that there's a lot to be done for patient advocacy. For example, some patients who may be particularly vulnerable, they may be vulnerable from a health standpoint. Vulnerable populations from a health standpoint might be children or the elderly, people that have weaker skin barriers. So they may be more prone to conditions like eczema. And then eczema goes with asthma. So, these people that are more vulnerable, they may be children, the elderly, immune compromised patients. And then we have vulnerability from a social determinants of health standpoint. people that live in these more vulnerable communities, these lower socioeconomic communities that might be areas that are near factories, where there was already poor air quality. And then when you have this acute air pollution event, it could be worse. And so what are we as a society and medical community doing to advocate for these patients? That things to consider may be programs to provide air filters to folks who live in these communities who may not be able to afford air filters, to provide masks and sunglasses to some of these patients. So I think that there is a lot of work to be done, and that there are some wonderful physicians and programs that are currently working on this. But I think that it's really going to take an interdisciplinary approach of the medical community and also, government and also other stakeholders to protect our patients in a long-term sense from these issues.
Well, I just want to thank you so much. And I'd like to close all of my episodes with bite-sized action items for people that are listening that can help them change their behavior or maybe potentially improve something that they're already doing based on the discussion that we've had today. So what would be a couple of quick tips that you'd like to share with our audience with regard to protecting their skin health?
I would say if a person has not established care with a dermatologist in their lifetime as of yet, I encourage them to do so. Because again, sometimes it's only catalyzed by maybe a family member having skin cancer that someone realizes that they might need to see a dermatologist. But as we've now discussed, the risks that we are facing are increasing, and that skin cancer is largely preventable if people are simply diagnosed in time. And so that involves establishing care with a dermatologist, being checked, understanding what your risk factors might be, and then having this discussion about your personalized regimen on how to protect yourself. And then I would say to try to follow the discourse on climate and air pollution and health, because new information is coming out every day. I'm writing about it. And I think that in our Harvard community, if someone looks at some of the work that's being done, there's increasing information coming out on this issue. So I would say go see a dermatologist if you've never seen one. Talk to your dermatologist about your personal plan for protection, and then follow the larger discourse about, public health interventions and recommendations in the face of climate change and air pollution.
Well, I just want to thank you so much for your time with us today. It's been really, really informative.
Thank you for raising awareness on this issue.
We've talked with Dr. Shadi Karush and Dr. Daniel Swain about how climate change is increasing the risk for extreme heat and wildfires. And these exposures have the potential to impact our health in many ways, some of which we're just starting to understand, like the risks to our skin. It's great that we have someone like Dr. Karush who's also studying the best ways we can protect ourselves knowing these risks. To find out more information about our guests and their work, please check out our show notes. Thank you so much for listening. Please take a moment to follow, rate, and review this podcast on your favorite listening platform. If you'd like to send me an email about topics you're interested in or questions for future guests, please send me a note at webmdpodcast@webmd.net. This is Dr. Neha Pathak for the WebMD Health Discovered podcast.